Looking at these selected axial images from the post-contrast CT brain study, we immediately see something concerning. The dural venous sinuses, which we expect to see nicely filled with contrast, are completely opacified. None of the venous sinuses, including the superior sagittal sinus and transverse sinuses, are visualized. There's the appearance of the classic reverse delta sign in the superior sagittal sinus. This is quite characteristic and strongly points towards extensive thrombosis in the venous sinuses. Additionally, there are filling defects noted in both internal jugular veins, which supports the idea of thrombosis extending further along the venous pathway. Notably, in the right internal jugular vein, we see this high attenuation crescent of contrast surrounding the filling defect, suggesting that the contrast phase is venous and optimized for evaluating these venous structures. All of this is highly suspicious of extensive thrombosis of the dural sinuses, which would be quite a significant finding in this patient. Beyond this, we see an area of low attenuation in the left frontal lobe, suggestive of an infarct, likely secondary to this thrombosis. Given the extensive nature of the thrombosis, it would explain neurological symptoms the patient might be experiencing. It's essential to emphasize that the rest of the intracranial arterial system, seen in the available images, looks unremarkable, but we would always thoroughly review all available imaging, especially to exclude any arterial involvement. I would convey these findings to the referring clinician immediately, as this case would require urgent intervention, possibly involving anticoagulation therapy or further specialized care. When talking about dural sinus thrombosis, DST, several anticipated questions could come up. One question that might be asked could be, what are the early imaging signs on non-contrast CT? Here, it would be critical to mention looking for hyperattenuation in the dural venous sinuses, the so-called cord sign or areas of venous infarction. You could also be asked about other imaging modalities, such as MRI, where you'd look for changes in the T2 signal, or the classic empty delta sign on MR venography. There might also be a discussion about possible causes of DST, ranging from dehydration and hypercoagulability to sepsis, trauma, or even complications following viral infections, like in this case. So that's the rundown on this case. And before I forget, if you're enjoying these quick radiology breakdowns, don't forget to subscribe to Radiology Made Easy. With every subscription, you stay updated with practical radiology insights that can sharpen your skills and prep you for your next exam or case discussion.